Hi everybody, my name is Dr. Zainab and today I'm going to be talking about prostate cancer. What is the prostate? The prostate is a small gland in the pelvis of the male reproductive system. It is the size of a walnut and it sits just below the bladder and it covers or surrounds the tube that delivers urine from the bladder to the outside world. The function of the prostate is to create a thick white fluid which creates semen when it's mixed with sperm that comes from the testicles. Now, the causes of prostate cancer. The causes of prostate cancer are largely unknown, but there are certain things that can increase your risk. Older age, women over the age of 50 are more likely to get prostate cancer. For causes unknown, those of Afro-Caribbean descent are more likely to be at risk. A strong family history of prostate cancer is also a risk. And some research suggests that obesity is also a risk factor. So what are the symptoms of prostate cancer? Now, prostate cancer does not produce any symptoms until the prostate is actually large enough to cause pressure on that tube that it's covering that carries urine out of the bladder. So the symptoms are all related to the passing of urine. Now, these symptoms may not be related to cancer of the prostate. They could just be related to enlargement of the prostate, which is also a common condition as men get older. But generally the symptoms include needing to pass urine or pee more frequently, usually at night. Urgency, so needing to rush to the toilet. Difficulty in starting to wee, so we call that hesitancy. Straining or taking a long time to wee. The flow of the wee or urine is weak. You feel like you haven't fully emptied your bladder. Or if you have blood in the urine, or blood in the semen. Like I said, some of these symptoms could be related to an enlarged prostate, which can be common in most men and can be treated with medication. So please see your GP if you have any of these symptoms. So if you have any of these symptoms, your GP will most likely do three things. First, check your urine for potential infection because some of these symptoms could be related to that. So we'll send the urine to the lab and if you need antibiotics, we will provide that. Secondly, you may be asked to do a blood test called a PSA, prostate specific antigen test. Now this test is not specific for prostate cancer, but it can go up in prostate cancer. So if you do have a raised level, you will be referred on to have further tests. But it can go up in things like infection, excessive exercise. So it's really important not to rely on this test. The other test that a GP can do or a health professional can do is the examination. So it is a rectal examination, and by doing that, we can actually feel what the prostate feels like. Is it large? Is it small? Has it got a different shape to it? So that is a very important test that we can do, and we can actually refer just based on what we feel when we do the prostate exam. One thing to say is that prostate cancer is a very slow growing cancer. So you may have had it for years and not known about it. If the tests do come back positive and you're referred to the urology team at the hospital, then there are various things that they'll do to try and help you manage the symptoms, but also manage the cancer. And the way it is managed depends on the type it is, the size it is, your general health, and whether the cancer has spread to other parts of the body. Sometimes the cancer is so early that they just need to monitor. But obviously this has to be discussed extensively with the team. The different types of treatment include surgery, chemotherapy, radiotherapy. And again, it all depends on what the plan was and what stage it was detected. Just to say, there's no screening program for prostate cancer. So it is really important that if you have any symptoms, to see the GP and get investigated. Thank you for listening to the video. I hope it's been useful. See you on the next one.